Shiny. All right, so what I would suggest is the Stephen King version of Beauty and the Beast. Where would you like to start with regard to The Shining?
Maybe just Jack Torrance, right?
I think it's fair to start with Jack. All right, so if we're looking at Jack Torrance as a fictional case of a mental disorder, would you think that he demonstrates choice A, psychotic dissociative, or choice B, mood anxiety? What's the consensus of this group? Psychotic dissociative. All right, so let's, and again, it really doesn't matter with regard to your choice A or B. Because it really just selects which route you want to take to the single best diagnosis. Either way, we're still going to get there. Psychotic dissociative spectrum. If choice A, if psychotic dissociative, next step is to choose arbitrarily one illness from which to work. It should be the same illness for any movie we discuss. It should be the same illness for any patient we discuss. Which one illness should we start from? Schizophrenia. Again, there's no right answer. This is arbitrary. We're going to choose to start from schizophrenia. Next step. Tell me the 5 criteria that define schizophrenia. Some will refer to them as the A criteria. Capital letter A lists 5 symptoms. What are they? So alogia is an example of a negative symptom. Any negative symptom we're ruling, that's number 1.
Hallucinations, delusions.
2 and 3.
Disorganized behavior.
Disorganized behavior, number 4.
And we got negative symptoms.
Disorganized speech.
Disorganized speech or thought process is number 5. You only need 2. At this point, would Jack Torrance rule in for schizophrenia? Does he have 2 of those 5 A symptoms? The answer, I'm getting nods. Support your diagnosis at this point. What is the scene? What have you seen that would confirm that he has at least 2 of those 5 symptoms of schizophrenia?
So his hallucinations, the ballroom, basically anything that happens in the ballroom. He imagines people there. There's the bartender. There's also the iconic scene in the bathroom where he meets the hallucination that can actually be called a command hallucination because he's essentially a person that, in a subtle way, tells him to kill his family, and then
Subtle.
well, yeah, you're
All right,
right.
I'll give it to you.
Subtle-ish, not direct.
This is the discussion with Delmer Brady, right?
Yeah, that's his name.
He is going to correct them.
Correct. I said that because he didn't use the word kill. So.
He didn't use the word. You're exactly right.
So yeah, there's the hallucinations. Disorganized behavior. I don't know if this qualifies, but the book he writes. So I guess that does qualify.
What do we
Yeah, I
think?
think so. I think there's sufficient evidence of disorganized behavior in Jack Torrance. And if we're going to just observe his behavior, turn the volume off, and just observe his behavior. That sense of foreboding that you get as countertransference, I think is actually picking up on disorganized behavior. Yeah. So he has at least 2. The next step is to appreciate that this condition, schizophrenia, is a diagnosis of exclusion. And we really can't diagnose it without addressing 5 other illnesses, any one of which, if they rule in, would take precedent. So which 5 illnesses now must the team consider with regard to Jack Torrance's behavior?
Substance use disorder.
Substance use disorder, and specifically a substance use psychotic disorder,
Psychosis,
right?
yeah.
Number 1.
Due to a general medical condition.
That's right, psychosis due to another medical condition, that's 2.
Alcohol not being included in substance, or what?
No, wait. 3 more. primary mood disorder.
Sorry, that's the question. What's the question?
Oh, we're talking about 5 disorders that the clinician must rule out in order to rule in schizophrenia. So far,
Autism and schizoaffective.
schizoaffective, and the final one is an autism spectrum disorder. Good job, all right? So, question number 1. Is The Shining a fictional case study of a substance-induced psychotic disorder?
He has a history of alcohol abuse, but it's not substance induced at the current
Right.
episode.
So there's 2 parts of this, right? First, we have to see and we have to address whether Jack Torrance has an established substance use disorder, and the answer to that is yes. I mean, that's right in the script, right? He has alcohol use disorder. We believe he's recovering, meaning that he's abstaining from alcohol, although the length of his recovery or duration is suspect. He gives the ghostly bartender, Lloyd, one duration. Wendy tells a visiting physician, a pediatrician, earlier, a different one. So we're not exactly sure, which does raise a red flag, right? And this is a clinical pearl with regard to treating individuals with substance use disorder, and that collateral information is very important. In this case, Wendy, in telling us, I think it's 3 months, is telling us a different duration than Jack's self-report. So that's a consideration here. But he does have an established substance use disorder. The next question is, in this case, alcohol inducing his current psychotic symptoms? We don't think so. So there are several ways in which alcohol can do this. We kind of discussed this through Seifeld this morning. One is through direct intoxication. All right. Any evidence of this?
I mean, if you're to take the ballroom actions as literal, then he was drinking, but I don't think you can take them as literal. They're most likely a hallucination.
I agree. That'll be tough. We're told by Mr. Ullman that all of the alcohol has been removed from the overlook. And because of that, I agree. It's hard to look at what happens in that ballroom as reality, especially when the actual way we got here is by saying that it's through a psychotic process. So probably not reality, probably divorced from reality. Withdrawal. Withdrawal is a second way in which alcohol may induce psychosis. Again, we talked about this with regard to alcohol withdrawal hallucinosis, as well as alcohol withdrawal delirium. Are either of these a likely diagnosis of Jack Torrance? Not likely. How come?
According to him, and I think according to Wendy as well, it's been 5 months since he had a drink, or some sort of number of months.
It's been a while. The only thing I would be very careful of is, remember, Wendy tells us a matter of months. Jack actually says years.
Oh, yeah.
Right? And I'm not really focused on a number per se, but I'm definitely concerned about the difference in reporting. Meaning that if we really don't know, maybe it's only 24 hours. Maybe it's only 3 days. That's the concern I have. Having said that, while clinicians should always have a high clinical index of suspicion, the fact is that Jack really doesn't give us any other signs or symptoms of alcohol withdrawal.
Also, it seems to be like where like delirium would be more like waxing and waning. It seems to be like almost progressive, and it just gets progressively worse like over time.
I agree. And that's one example of what we're missing. I mean, we don't see tremor. We just don't see other aspects of alcohol withdrawal. So, not likely to be alcohol-induced psychotic disorder through the withdrawal phase. There's one more way we discussed this morning that alcohol may be related to psychotic symptoms. What was that?
Alcoholic hallucinosis.
Well, that's part of withdrawal.
Where
Wernicke's-Korsakoff syndrome. Maybe?
do we see ataxia?
What about the ataxia?
I'm saying we don't see any ataxia.
Well, we do, but it's after he falls down the steps. Again, metaphorically or symbolic.
But isn't the ataxia and working encephalopathy usually consistent? Or is
Yeah,
it
yeah. But he may have been encephalopathic in the prequel, there is no prequel, but in the history. And it may now have progressed to Korsakoff psychosis. So maybe some confabulation, there might be amnesia, and if so, then the psychotic process that we have identified might be Korsakoff psychosis, pretty much the end stage of the Wernicke's-Korsakoff syndrome. So that's a possibility. So we don't see him encephalopathic, I agree. But then again, maybe that was the prequel. So I think we have to leave this in a differential. I don't know how high it is, but I think it's something that we should, I mean, we're getting a thiamine level, right? And if this were a patient of ours, we're giving him IV thiamine. In this case, we're not going to go with 100 milligrams by mouth daily. In this case, we are going to give 500 milligrams IV, TID, 3 times a day. We're going to give him Korsakoff doses.
We have a new concept, by the way.
So, substance-induced psychotic disorder remains our differential, specifically Wernicke's-Korsakoff syndrome, specifically Korsakoff psychosis. Is The Shining a fictional case study of a psychotic disorder due to another medical condition? So again, the first question is, does either Stephen King in his novel or Kubrick in the film discreetly identify a medical condition in Jack Torrance? So again, the hesitation is a no vote, right? Collective hesitation is a no vote. The question then comes, does the absence of discrete information reassure us as clinicians that The Shining therefore is not a case study of psychosis due to an underlying medical condition? Why not?
The absence of information is not necessarily evidence that there isn't a general medical condition.
Exactly right. Why? Especially in this case. What are the 2 risk factors or protective factors that clinicians should focus on here, especially in the artificial environment of a shelf exam?
He's an old white male.
Right. Sex and age. He is older and he is male. He has both risk factors. So the absence of discrete information in the script should not reassure us. If he were young and female, on a test, you can assume health, physical health. That's how we operationalize physical health on standardized tests. Of course, there are 2 intermediates which pose some diagnostic difficulty. But in this case, he meets both risk factors. So we're going to keep this in our differential diagnosis. So just to case formulate, we see a middle-aged male with evidence of psychotic features for which we cannot definitively rule out Korsakoff psychosis given his secondary diagnosis of alcohol use disorder, and due to his age and due to his other risk factor of being male, we also cannot definitively rule out that his psychosis isn't due to an underlying medical condition. Quick case formulation in summary where we are right now. We still have 3 other illnesses to consider here. And again, this is us ruling out schizophrenia. Is there a mood component? Because if your answer is no, both primary mood disorder with psychotic features and schizoaffective disorder can be taken off the table. Do we think there is a significant mood component in Jack Torrance's presentation?
So, he's very like agitated and irritable, but I don't know if there's necessarily like a mood component. I don't know. I was trying to assess for like mania, but he was saying like he feels like very tired and like he seems like he's very like, his concentration's pretty bad. But, so I think that like argues against bipolar or something like that. But depression, I guess, could be like a possibility. Like he has like low energy, low concentration,
Also insomnia.
insomnia. So I guess that is a consideration.
So it sounds like the group conservatively would want to leave this in. This, what I mean, is a primary mood disorder as well as schizoaffective disorder. However, it looks like it's going to be lower in our differential. Right? So that's fine. We can do that. Again, conservatively, let's keep it our differential, and we'll keep it low. Finally, is The Shining, or is, put it this way, there is evidence that Jack Torrance is afflicted with an autism spectrum disorder. A, yes. B, no. C, doesn't matter.
Doesn't matter.
Why does it matter?
Hallucinations.
That's exactly right, because of the hallucinations. The American Psychiatric Association included ASD in this differential because of the disorganized behavior and the disorganized speech of ASD overlapping with the clinical criteria of schizophrenia. And if an individual with ASD, as an adult, presents with disorganized speech and behavior, they may be misdiagnosed with having schizophrenia. So to protect against that, an autism spectrum disorder is put in that differential as a necessary rule out. However, even in individuals with established ASD, if they go on to develop hallucinations and or delusions, they cannot be attributed to the pre-existing ASD. And that's exactly it. Jack has both, really. I mean, he's got some delusional beliefs too. We didn't cover this, but he certainly has some fixed beliefs about what's going on in the overlay. So there is ample evidence that he has schizophrenia, even if hypothetically he had been previously diagnosed. There's that prequel again, with an autism spectrum disorder. So where we are right now with regard to using schizophrenia as a provisional diagnosis, we have one final step, and that is if, hypothetically, you took notes during this movie and you had those notes in front of you right now, and you were looking only at your notes page titled Jack Torrance. If you then crossed everything off that notes page that would be explained by the illnesses we want to keep in our differential, would there be anything left? Because if your answer is yes, you obviously have to explain that, meaning that we have to continue with our differential and perhaps include additional diagnoses, axis 1, as well as potential axis 2. So, what do you think? Would you hypothetically have anything that is not crossed off your list? No, I'm getting no. So we're here.
I have a list actually, and no, it's all like schizophrenia.
Because the answer is no, then we're done. This has been the case formulation of Jack Torrance. We think it's a primary psychotic process. We think a provisional diagnosis is schizophrenia. We understand that we cannot definitively rule out that due to an underlying medical condition without further workup and evaluation. Certainly a substance-induced psychotic disorder remains high in our differential. We're probably going to give him IV thiamine. And because there may be a mood component, we will also keep both schizoaffective as well as a primary mood disorder and a differential. Now, it's going to be somewhat, I don't want to use the word easy, but certainly something we can address with regard to where we are right now pertaining to this schizoaffective versus primary mood disorder dilemma. That is, where we keep them in our differential. Number 4 versus 5, 5 versus 4. What we need to know in the history, Jack's past history, is the time frames of these symptoms. If he has co-occurring mood and psychotic symptoms, and we see any frame of time where he has one but not the other, that will reveal what disorder it is. So if he has a frame of time in which psychotic symptoms exist in the absence of mood symptoms, then not only does it strengthen the idea of schizophrenia, but we probably could include schizoaffective disorder to the extent that we are identifying clinically significant mood symptoms. On the other hand, if an individual like Jack presents with co-occurring psychotic and mood symptoms, and we see a frame of time in which he demonstrates mood symptoms, absent psychotic symptoms, then this appears to be a primary mood disorder. That means schizophrenia is off the table. That means schizoaffective is off the table. And now we have a primary mood disorder with psychotic features, and that's where we talk about the depressive disorders as well as the bipolar-related disorders. So that's the way I would pretty much formulate where the mood symptoms fit in. We just don't have that prequel. Okay, so if you guys want to write it up and definitively tell us what is going on in The Shining, that would be helpful. All right. Any other characters you want to tackle here?
Should one of us see the new console? Sorry to interrupt.
I don't know. I think that Danny's character is really like interesting. I mean, I know that he has like The Shining, so that like kind of complicates like how we're gonna, because obviously it's a fictional thing that they're giving him. But
well, listen,
There is a sequel.
you're that pediatrician.
there is a sequel, yeah.
Dr. Steve, right? Anybody here going into pediatrics?
I might go into, sorry, go ahead. No, go ahead. I might go into pediatric emergency. I'm not sure, yeah.
Okay. Danny Torrance presents to your emergency department. And upon your history taking, he introduces you to Tony. All right. Are you going to agree with the pediatrician in the movie and reassure his mother that this is fine? Why or why not?
So I didn't watch this movie, but I'm guessing I wouldn't.
Doesn't sound like something you'd be comfortable reassuring.
Yeah.
Any reason why?
So while he is like having imaginary friends at that age is like still normal, I think like, I don't know, if I had just seen him as the pediatrician, I would definitely want to know if they're like, I mean, she mentions that there was like physical abuse, but there could be like more to it, and more like there could be sexual abuse, and that could be like, I mean, he says that like Tony lives in his mouth, and I feel like that's like really suspicious, and like, I don't know, it's just a little suspicious. Like I would definitely want to delve more into it and not just say like, oh, it's normal. Like it could be like due to like some type of trauma or something.
You know, for this further supportive evidence that when the pediatrician asks him, did you notice that Danny covers his genitalia?
Mm-hmm.
Right, as he's lying down in bed. And during that scene, you could also see that there is his teddy bear that he's resting on that is literally above his right shoulder, which connects directly to the teddy bear scene at the end.
Right.
When Wendy sees the infamous bear man performing fellatio. Oh, by the way, did you notice what Jack Torrance was reading when he was in the waiting room for the initial interview with Ullman?
So when I was like suspecting the sexual abuse, I looked it up, and I didn't see it personally, but I saw like on an analysis of it that it was Playgirl, and I think they actually like literally in that issue mentioned like incest.
Yeah. Well, when it's okay to have sex with your children.
Mm-hmm.
Yeah. So there's more than circumstantial evidence that Jack Torrance may be sexually abusing Dan. So I don't know if we can simply say this imaginary friend is just a phase, the way the pediatrician does it. Oh, by the way, why was she consulted? Why was she providing that house call in the first place?
He lost consciousness, I think? Yeah.
She seems to just have forgotten that.
Mm-hmm.
That he lost consciousness, and she doesn't connect the dots here. And she reassures the family and allows them to take this child away to an isolated, overlooked hotel for 6 months where there'll be no access to anything, much less medical care.
Right.
Not the most evidence-based approach to treating children. So that's a good call on your part. you would not have
Okay.
sure.
And I think like other things that point to that there might be more extensive like abuse, whether it be physical or sexual, is like he kind of like dissociates and becomes like Tony at one point. And then like I noticed like after he came out with the bruises on his neck, he was like sucking his thumb, which is like kind of a regression or like a coping thing for stress. So I mean also an oral fixation could be too, I don't know. Like something.
Having an imaginary friend and becoming the imaginary friend are two very different things.
Mm-hmm.
Imaginary friends may be age appropriate, but even when you're at that or in that age range, becoming and dissociating into that imaginary friend is completely different, especially when it results in sympathy. So, yeah. So I agree. I definitely agree with you. However, remember, we have rules to these discussions with regard to looking at these films as fictional case studies. Number one, and I'll bring it back to Jack Torrance. A lot of the movies, especially the horror movies that we choose to discuss, have an antagonist, maybe even a slasher. Today is Friday the 13th, so a quick shout out to Jason Voorhees, that certainly demonstrate a blatant disregard for and violation of others' rights. That is, they actually have the very cardinal trait that defines the antisocial personality disorder. So because that is true for almost every movie we're going to discuss, we're going to agree that these movies are never going to be about antisocial personality disorder. It's just way too easy. The other part of this, and the idea of The Shining, I think is critical here. A lot of these horror movies start out with someone being victimized, haunted or otherwise. They usually tell someone who doesn't believe them, only to have that someone clearly be revealed that, boy, what I was told is actually true. They come to be a believer. Usually at the end of the film, usually when it's too late. Because of that, a lot of these films can be flipped as a fictional case study of a psychotic process called shared psychotic disorder. And because it's way too easy, we're not going to do that either. Right? Although I want to make a little bit of an exception for The Shining, and I'll get to why in just a second. And last but not least, many people who are haunted are usually traumatized. It's very difficult to become possessed or haunted or other, and not have the basis of trauma informing the rest of the movie, pushing that proverbial narrative forward. Therefore, our movies, arbitrarily, we will agree, are never about PTSD, despite the fact that clearly Dan has PTSD. Right? So those three low-hanging fruits we're going to dismiss just because if we didn't, we would sit in this room for every single movie discussing antisocial personality, shared psychotic disorder, as well as post-traumatic stress disorder, and all we got to do is go through it once, and you guys know it, you'll be ready for your exam. You don't need to repeat it every Friday. Having said that, let's use this time to briefly discuss the phenomenon of a shared psychotic disorder. Because the reason why I think The Shining is the best case for this is because of that infamous Room 237. It's so infamous that it became its own movie. Right? It actually is something that became a documentary that is a movie about the movie, The Shining. Danny goes into room 237 and apparently sees something. He goes back to his mother, who quickly goes to Jack, who quickly dismisses it, reassures, goes to the room, has the same experience, comes back to the suite, and then lies to his wife. Right? So, because it really revolves around room 237, The Shining is the one exception I like to make about the film being about shared psychotic disorder. The other reason why I want to bring this up is because not only does it focus on room 237, but perhaps just as importantly, it goes against the textbook. The text will tell you that the individual with the index case shares these signs and symptoms with someone who is dependent on them. So it usually goes from father to son, not from Danny to Jack. And it's because of that variable that I think discussing shared psychotic disorder in the context of The Shining is fun. So explain that to me. Why in the world would this go from son to father in this particular movie, making The Shining the movie you like to discuss shared psychotic disorder? There's two answers here. Number one is, Jack Torrance is not an adult. He's regressed. Right? Jack Torrance is a regressed figure. And metaphorically or symbolically, I would ask you to watch the movie again when you have time. Kubrick includes several references to children's books and cartoons to symbolize that very regression. And you can count them. There are double digits, but it's great. It's a form of regression, or at least it's symbolic of regression in Jack Torrance. So he is a regressed character. Also, Danny's precocious. And we know why. He's lost his childhood. We know why. A child his age had to grow up real fast and understand how threatened the world was, because his very home was deemed not safe very, very early. You already uncovered that. So we have a regressed adult, but we have a precocious child, therefore explaining why the transmission of shared psychotic disorder goes from son to father, which is not what the textbook says. There's one more part of this, and we're going to end here. Danny's precocious nature is introduced to us rather early in this movie, and I'm focusing on that car ride when the family goes to the overlook, because he brings up a subject that children should not bring up.
Yeah, I can't remember exactly what they were talking about.
Anybody remember the topic he brings up? Cannibalism. His mother, and they scolds him, but quickly says we shouldn't be talking about this. Danny answers his mother back. Right? It's all right, Ma, I saw it on TV. As soon as he does that, the next words come from Jack's mouth. Now, if you're sitting in a car, and I'll ask the men in the room, what should the next words that come out of your mouth be seconds after your son talks back to his mother?
Hey, stop that.
Right? This will not appear on your shelf exam, but it's probably the most valuable lesson you're going to learn in your rotation. Right? You do not triangulate and pair with your son, triangulating your life. It's not going to go well. And it doesn't go well for this family. Jack's words do not include, don't talk back to your mother, however. They're actually directed towards Wendy. You see Wendy, the child already knows. I'm paraphrasing. Wrong thing to do. But we get a glimpse into this family's dynamic, and we understand fully what's about to happen. Even though we may not know that, we know what's going to put us about to happen. There's another reason why this car ride is very critical to the understanding of what The Shining is really about. Because we also understand, and this may have occurred during the initial interview, that the land is cursed. Recall why the land that the overlook is built on is cursed?
It's an Indian burial ground?
Yeah. Yeah. That's brought up explicitly in the script, and it's discussed significantly in the movie Room 237, the movie about the movie. When we put all these together, we have someone talking about cannibalism in respect to Native Americans. This comes up in exams. The third part of the triad. Number one, again, Native American. Number two, cannibalism. The third part of the triad is psychosis, which I think we would all agree is the theme of The Shining. That triad defines what mental disorder, specifically a culturally bound disorder, that does often appear on exams, including shelf exams.
Kuru?
That's not Kuru. Kuru's not Native American.
I don't think it was.
That's two of the three of the triad. If you Google real fast, psychosis, Native American, cannibalism, mental illness, what comes up?
Oh. Let's see, Korea.
That's Kuru.
Oh, that's Korea.
Yeah. Wendigo?
Wendigo, here it is.
Oh, yeah.
Yep.
I don't think
Wendigo psychosis is a culturally bound syndrome of Native Americans, originally from the Algonquin tribe, in which it was believed that if you talked about or thought about cannibalism, you would be made to be psychotic. The cannibalistic spirit of the Wendigo would possess you. This is a movie about possession. Right? Danny gets possessed. Danny dissociates. Danny demonstrates the Wendigo psychosis. And it's Danny's Wendigo psychosis that then transmits to Jack through the mechanism of shared psychotic disorder, or twist to the shadow.
What's
you-
Kuru? Sorry. What is Kuru for the group? What is Kuru?
I forget which exact culture it is. Which culture is Kuru?
I thought,
Well, there's two different things, Koro and Kuru.
I'm thinking Kuru when they eat the brains and.
That's a prion disease in South, I think originated in South America. Koro is in Malaysia and other parts of Asia, in which individuals have the delusional belief that the genitalia are shrinking. Two separate
Kuru.
illnesses.
Yeah.
Koro
Kuru
and
and Kuru.
Kuru
Okay.
is the one where they're eating cannibalizing the brains. You can get prion disease.
Okay. All right. All right. I'll look at that. Okay. Sorry. Go ahead.
isn't it more likely that we have the case of a schizophrenic father that molested a son, and the son is now dissociating and has PTSD? And in that setting, isn't it likely that the son might have a mood disorder with psychotic features and share delusions with the schizophrenic father?
Yes to all the above. We'd have to ask a child adolescent psychiatrist about the mood disorder with psychotic features in somebody that's young. Post-traumatic stress, very straightforward. I don't think there's any doubt about that. That's a no-brainer. As a matter of fact, it's such a no-brainer that we actually created a rule that we're not going to talk about PTSD. So if we leave that off the table, what else can we come up with to reach specific teaching points through The Shining? So I agree with you. The answer is yes. As a matter of fact, I think you're so much on point that we decided that we're not going to talk about it, right? Because it is so correct. It's absolutely accurate.
I just have a general question about shared psychotic disorder. Is that seen in like cults? Is that like something that would be like
Yeah.
in
The
cults?
mechanism
Where else
itself,
would you
yeah.
like see that besides like cults?
Mhm.
Is there any other place that's like prominent, or do families that share? I guess.
Yeah, I mean, I think so. We have to be very careful about this because when we focus on aspects of this, we have to remember that we're talking about delusions with regard to shared psychotic disorder, because there are milder forms of deficits of thought process that we can't call a delusion. We may call it a preoccupation, we may even call it an obsession, but it's non-delusional. And if you are going to add those into the equation, the answer is yes. There are multiple examples where people are put into groups that have a shared thought or ideology and adopt that ideology. That is incredibly prevalent. I mean, so much so that we don't talk about it, right?
Mm-hmm.
However, the American Psychiatric Association pathologizes it when it gets to the level of a delusion that is shared. We don't pathologize shared obsessional disorder. We don't pathologize shared preoccupation disorder. Those diagnoses don't exist in the DSM, but they do exist in the real world. And they're very, very prevalent in the real world. I mean, again, the general mechanism is someone who doesn't have strong feelings about something, but becomes part of a group, name the group, and over time adopts the group's thinking. That happens. And that can even become clinically significant. And that can become clinically significant even when it's not delusional. But the American Psychiatric Association has not gone there. Make sense?
Yeah. Have you ever seen Midsummer?
Have you seen?
Midsummer.
Yeah.
Would you say that's like a shared like? I mean, but I know there's also like concern for substance too, because they drink like that
Substance,
tea.
The
But
only thing about Midsommar that I'm a little, not, at least for a teaching point, is to what extent is it culturally sanctioned?
right.
And what extent then does that culturally sanctioned behavior even rise to a religion?
Okay.
Because when the R word is used, psychiatry, hands off,
Okay.
right? Culturally sanctioned, psychiatry, hands off. Yet the idea here being that if somebody from Midsommar came here and talked about or behaved in such a way that is consistent with their culture but inconsistent with this culture, that's a gray area, right? Psychiatry has to be very careful dismissing one's culture and saying what you're doing does not fit here and is leading to clinically significant behavior. That's a gray area that most psychiatrists will usually err on the side of saying normal, at
Okay.
least on shelf exams.
Mhm.
So I was reading about shared psychotic disorder, and I was reading someone classified into 4 different types, with one type being imposed psychosis, where it's transferred from one individual to another within an intimate relationship, which I think was what you were discussing before. And then there's another type called simultaneous psychosis, where both partners share the psychosis simultaneously. They both have risk factors through long social interactions.
Yeah.
Which I think was the other case I was talking about.
Yeah,
where-
I think it's called, and I don't speak French, I think that's called folie simultanée.
Yeah, exactly.
Yeah, that's actually Hancock, with, starring, Will Smith. Anybody see that?
Yeah.
Oh, yeah, Hancock.
That's folie simultanée. Again, that's mispronounced, so, yeah. Yeah, and there's also variants too. I mean, we often think folie à deux, shared psychotic disorder. There's folie à trois, there's folie familier, again, mispronounced where it's a family, which could be The Shining.
Mhm.
So, yeah. And again, I think because of the role the room 237 plays, as well as it going in a direction that you would not expect, I like The Shining as the exception to the rule, where we allow ourselves to actually talk about shared psychotic disorder, or even folie familiar. We'll stop.